Everyone, good morning. Today is a talk about asthma follow-up in clinic. So I emphasize to consult with your provider for further questions and or concerns. This is not meant to treat but to provide basic knowledge that will prompt you to either seek professional advice or not. So in this section, it's also for the providers as well, is to consult with the GINA guidelines as well. It is the global initiative for asthma presented into 2023. Asthma management is to optimize symptoms, decrease the risk of asthma exacerbations, and preserve lung function. The expectation is for the person to participate in any activities without physical limitations that involves breathing. So first thing to do is to obtain a detailed history of the child. Cough, particularly if worse at night, cough more than 2 nights a week, daytime wheeze more than 2 days a week, nighttime awakenings, and symptoms that also occur or worsen in the presence of exercise, viral infection, animals with fur or hair, house dust mites in mattresses, pillows, furniture, carpets, also mold, smoke, tobacco, wood, pollen changes in weather, strong emotional expression like laughing or crying hard, airborne chemicals or dust, menstrual cycles, smokers at home, pets at home, any history of eczema, allergy, food allergy, or family history of asthma. Is there any recurrent wheezing, difficulty in breathing, or any chest tightness? And what are the current medications that they're taking? Any frequency of it, like the short-acting beta agonist, also called SABA, oral steroids in the last year. Is it getting worse or better? Were there any ER are there any ER urgent care visits in the last year? Ever been hospitalized for asthma? Any childhood risk like prematurity, pneumonia, RSV, parent smoker, missed school days in the last month, missed activities or sports, effects on family like psychosocial wise, and any triggers. Then after you get the history, classify the severity of the asthma. Is it intermittent, mild, intermittent, moderate, or severe? And then you can formulate your treatment plan. Keep in mind that when you provide treatment plan, always follow through. There will be times when you ask them to come in a day or two just to make sure they're doing well with the current treatment, or if they're stable, you can always you can ask them to come back in a week or 2 weeks. The goal is to eventually use the short-acting beta agonist, which is the SABA, and not add many types of medication. And these are recommendations for the professional experts on how to gather history on the kids, the children that are presenting to you with asthma, which is the follow-up in clinic. So again, seek medical professionals for questions and answers, and I'll see you in the next one.